So there's this weird situation that comes up more often than not in American healthcare. I work at a hospital, and um, I do a lot of discharge planning. So I'll see a patient, and we'll have to decide, if it's safe for them to go home or to a skilled nursing facility, get home health, go to outpatient therapy, or go to another facility that would be appropriate for them. Now, this is, of course, a team decision, but therapy has a lot of say in terms of where would be the most appropriate and best place for them from a functional standpoint. And what's interesting with this particular case is this person, they make too much money because they have Medicare and Medi-Cal. So Medicare is like for people 65 and older or disabled, and then Medi-Cal is for lower income. But they make too much money to qualify to go to a skilled nursing facility, but they don't make enough money to get additional caregiver support at home. At least they don't, or I'm sorry, they make too much money to get additional caregiver support at home. And too little money to go to an assisted living facility where they'd be around more people, because the average cost of assisted living facilities in the United States is on the low end like $4,500, and on the high end can be above $10,000. If you're at a really nice place, particularly in like California or some of the coastal cities. So there's this odd situation that happens to millions of people, I'm sure, where they don't have enough family support. There are certain things at home that are just difficult, like being able to cook for themselves or being able to take a shower by themselves. And if they don't have family there, then that can be really difficult and scary. And this particular person also has other medical issues, and so they can't, they can't make it to dialysis appointments on their own, and they have to get up and down stairs in a second floor apartment. There's like 18 or 20 stairs to get into this apartment. I'm giving you all these details because, like, this happens to so many people where there's just nowhere to send them. Like, we have to send them home because they can go upstairs and they can do those things at home, but it's really, really difficult. And, of course, like, the solutions are, number one, don't get that sick in the first place, which for a lot of people is possible. Most of these things are preventable, but for some, it's not. Like, sometimes you get in an accident, or you have a genetic condition, or like you were doing all the right things and just got dealt a bad hand, like a bad set of cards, bad hand. And so it's not to say that there aren't cases where people did everything right and they're still getting the short end of the stick, but in a lot of cases, these problems that they're experiencing now happened because just for whatever reason, they were not able to live a healthy lifestyle, and now they're in this situation. And again, I'm not necessarily saying it's completely their fault. Like, there are a lot of social reasons, income, tons of different reasons why somebody cannot do those things. Like, our society is not set up in a way where, at least in the U.S., where people are incentivized to be healthy. But that's another video altogether. But so back to the point is that nobody, like, I don't know the solution to this necessarily, because, like, let's be real, like, most people are not going to start working out and exercising and changing their life. I mean, as much as I want that to happen on a massive scale, it's not going to happen. You need resources and, like, society to actually change for that to happen. And then, like I had shared earlier, another option is for them to go to, like, an assisted living facility. But you've got to make more than the median income of retirees in order to afford that. And there's a good swath of people on the lower end of the income spectrum who definitely will not be able to afford that, who also don't have family members to support them, right? So, okay, they can't go there. Well, the next option is you just send them home, and then we just have to wait for them to have like a catastrophic illness, and then they can go and qualify to be in a skilled nursing facility. So it's like we're just kind of kicking the can down the road in a sense, and it's just really shitty that things are set up that way. Really shitty, because this is somebody who probably needs help, but is just like too good and makes a little bit too much money to get it. And that is really, really messed up. So this is not all doom and gloom. I do have some ideas. One idea that I had, I'm curious to hear what you guys think about this, is to instead of sending them home with no services, we could send them home, and then the hospital itself could invest into the well-being of these people, because oftentimes these people are readmissions who keep coming back, and yeah, they'll bounce around from hospital to hospital sometimes. So it's if the hospital itself partnered with other providers in the community or other organizations like different nonprofits to actually help these people be healthier, in the sense of controlling their glucose and their A1C, controlling their blood pressure, helping them get on an exercise program, all these sorts of things. If we can invest more into the kind of bottom 10% of people who are unhealthy, I bet that would, number one, help them be healthier, but also reduce overall costs to the hospital and just to the community at large. It's, based on my thought process on that is it's based on the Pareto principle, where the top 20% of spenders account for 80% of the total cost. And then usually you can extrapolate that further to where the top 10% of spenders are accounting for 90% of the cost. So if you can target the people who are utilizing lots of resources, who need a lot of help and just aren't getting it for whatever reason, and just put more resources towards those folks, I bet at worst you would have a net positive, or just like a neutral amount of money going in and out. So I don't know exactly what that would look like. I mean, you'd almost just have to have like an on-call like home health team. They could go visit with patients, not bill insurance, and just do that so that they could just stay healthier. But it's probably very unrealistic. I don't know. I'm going to look and see if that's actually being done in different parts of the country, and if different like hospitals might be doing that. So I'll probably make another video about some more of the solutions that I find. But big picture, of course, would be if we made our cities more walkable, if we made our cities safer, and overall, like, the cities were set up for people and walking and biking and not so car dependent. Like, as I'm walking, you can probably hear cars passing by. There's so many things that can be done in cities to just make them way healthier without even like forcing anybody to do more exercise. So, but again, that's for another video. I'll share that at another time, but I'm curious to hear what you think about this topic. curious to see if there's any solutions that you have heard about in your community that have worked. And then maybe I can even bring that to my community here. But I'm going to do some more homework on it as well. Anyways, have a good one. Thanks for walking with me. Bye.